Hi, I'm Dr. Djoko, and welcome back to Pharmacy Talks with D. We've established that addiction is a chronic disease, and just like other chronic disease, you can actually seek and get treatment for it. And we are fortunate to be in Danvers, where you can actually walk to a treatment center, and that will be the Recovery Center for America. And I do have some people from the Recovery Center for America here today who are gonna talk about what happens at the center and what is it that you can expect if you go and seek treatment. And for full disclosure, it is not the only center where you can seek treatment, but we are fortunate that it's located locally and easy access and walking distance from most Danvers residents. I do have with me today Janine Gilchrist. I hope I said that name correctly. She's the Director of Nursing at the Recovery Center for America. Welcome.
Thank you.
I also do have Kristen Quinn, and Kristen is the Program Manager for the Clinical Stabilization Services. Welcome.
Thank you.
And last but not least, I have with me Wendy Goddard. I hope I said that name correctly. Wendy is the Program Manager for the Acute Treatment Services.
Correct.
Welcome to Pharmacy Talks with D. So I'm going to start with you, Wendy. I always get calls and comments from viewers at home as to what is it that we need to do. And we've talked about on our last episode as to, they can call 24/7 services at the RCA, and they would direct them as to how to get into the center. What is it like for patients getting to the center? I suppose when they get in, they start by the acute treatment services, which you are in charge of. So can you elaborate as to what is it that the patient should expect once they get admitted at the RCA?
So once the patient makes the decision to enter our doors, our first priority is their comfortable detox.
Yes.
It's a medically driven unit.
Okay.
We do have 37 beds, and we're looking to get them as comfortable as we possibly can so that we have the time to clear up their minds and clear up their heads so they can make decisions and hopefully move forward in their treatment. So the first 24, 72 hours, they're uncomfortable. They're gonna have doubts. They've got worried family. They've got other things outside that they feel need attention, and we have to try to focus them as to what's really important. It's them, and that they deserve to be treated well, and they deserve to be comfortable.
Okay.
We'll also reach out. We have a team of case managers and nursing staff and recovery support specialists who will reach out to their families and make sure their family understands that they're safe, they're comfortable, and that we're going to work with them for the best possible treatment we can, and hopefully extend their stay so that they can really start to focus on their recovery. So those first few days are a lot of just some haven't had a decent hot meal in days. Some come in with nothing but the clothes on their back, or haven't been able to do laundry. I mean, we offer the facility offers all of those amenities to them, so they're comfortable. And some patients have even looked and said, I don't even feel like I deserve this.
Wow.
And they do deserve it, and that's what they need. So we have a very short window of time to accomplish such a great goal, which is to keep them in treatment so that they can get better and they can start their journey through recovery and rebuild those relationships with their families.
Perfect. Now, how long is that acute phase usually last? Would you say, is it a couple days? Is it a week?
Depending upon how long they've been out there, what their drug of choice is, and how much of it they've been doing, it can be anywhere from 5, 7. We've had some people who've had to detox even longer, 10 to 14 days. A lot of people, when you're looking at a timeline like that, how long were you out there? You know, did you start
Exactly.
using and abusing drugs at 14 and now you're coming in for the first time at 35 years old? Or have you put together some time? Maybe you've had a few years in recovery and you've had a slip, you know, and then they're coming in, and so it's not. So our nursing staff assesses each patient individually, because no two people's detox plan is going to be the same. So we rely heavily on the nursing staff to come in and assess and put them on the right protocols that they need. That's going to give them the success so that they can stay in treatment.
Perfect. That's great. Is it safe to assume that during this acute period, they are inpatients? It's not that they come and then they go?
Yeah. A lot of times they're you know, if they get uncomfortable, they're going to try to run. Like Dr. Ginter was saying in the previous episode, that, you know, they want comfort. You know, as you know, this disease wants instant gratification.
Exactly.
Okay.
Exactly.
So if they're starting to get uncomfortable, you know, we want to get them on the right path. It's not always just the medicine, though, to make them comfortable. We have staff that engages them, whether it's groups that they're attending to start learning about their disease. It could be recovery support staff who's having a one-on-one conversation about, you know, how good it can be, or that it's going to be okay. And the case managers can start working with them to lead them towards, you know, what the right path is going to be for them. So, you know, it's all not just, you know, substituting one medicine with another, or one drug with another.
Exactly.
A lot of it is up here. It's psychological, and we're trying to engage them in their own recovery and have them make choices, but healthier choices. It can be so simple as just going down to the dining room and making a healthy choice for dinner.
Exactly.
Whereas, you know, they might have been doing the 99-cent menu for how long at Taco Bell? I don't
Exactly.
know.
Exactly.
So we're trying to, you know, again, we're talking about the whole thing, you know, body, mind, and spirit. And we really need to, you know, start somewhere, and it's a good place to start.
Perfect. Thank you very much. That is very useful information. And once they go through that initial acute phase, it all is not stopped there, right? They have to continue.
We're giving them a slight taste of what they can have.
Exactly.
So once their mind starts to clear up, you know, once they start engaging in the activities, we have a schedule that's followed. We have our educational groups that are run. We have medically driven groups that are run that the nursing staff does to educate them, so they can start to understand what it is that got them where they are. A lot of them, you know, we don't want to rip that Band-Aid off. We kind of put the Band-Aid on because we want to get them comfortable, and then we're getting them to the point where they have that moment of, okay, you know, you know, I maybe I do need to go upstairs to, you know, to Kristen's program and put in some more time on this. It's not easy. If it were easy, or if money could buy you this solution, then we wouldn't be here today.
Exactly.
Okay, it's a lot of hard work, you know, and they need to know that. And there's no cure. There's no quick fix. A detox-only program is all it's doing is setting someone up to walk right out there on the street and have that uncomfortable feeling again. Whether it's the trauma, whether it's the depression, the anxiety, and again, they want the quick fix. So it's a lot of work.
Perfect.
But even in a short amount of time.
And it is a lot of work, but it's doable.
It is.
And that's a great segue to Kristen. So once they go to that acute phase, they now will go to the clinical stabilization services.
Right.
And what will happen next? So they've gone through that detox acute phase, and they come to you upstairs. I suppose it's upstairs.
Upstairs.
So what happens when they get upstairs?
So the hope is that every patient that walks through the door in detox will end up upstairs in the clinical stabilization units, mostly because we know that this isn't just a physical disease. It's a mental disease. It's a spiritual disease. So that's sort of when the physical stuff is stabilized, then we hope that they come up to our program to kind of work on the rest, which is really the meat and potatoes of recovery, is learning, you know, not only why people ended up in the positions that they did, but how we can help them move forward with their lives and start to rebuild from whatever it is that the disease might have destructed. So when they come up to CSS, we do have a little bit of a different staffing pattern because it's a clinical unit or a program. We have therapists, so master's level clinicians on site. Each patient that is coming up to our program or coming into our program is assigned a therapist
Yes.
and a case manager.
Okay.
They work really closely together in creating the person's plan for treatment and then after treatment. So that starts from the moment somebody walks through the CSS doors, just because we need to know what the patient is not only going to need while they're with us, but then also need when they leave us, so that we can
exactly.
set them up for as much success as we possibly can.
That's great.
In addition to the clinicians and the case managers, we have recovery counselors, we have recovery support specialists, we also have nursing. And, you know, I think what makes our program so amazing is the staff that work there.
Yeah.
They're so incredibly dedicated to the population that we serve, whether they've been patients before in the past,
Oh, that's great.
they're in recovery, or they love somebody that's in recovery, or they've been touched by this disease in some way or another. I think that's one of the most important parts of the program is the staff that show up each and every day to serve the people that we're trying to help. And I think the patients feel that more than anything.
Perfect. I really like that holistic approach. So it's not just care, take another pill and replace one
Right.
drug with another. I like the fact that you take a, holistic approach to it. And I did read at some point you have you at upstairs you do run several programs, and one that fascinates me was called the 12 steps. I mean, I have no idea what that is. So if somebody at home wants to know more about it, what is that, and what are the other programs that you do offer to these patients?
So we offer a lot of different services, I guess you could say, within CSS. And it is a 12-step based program. So there are fellowships that, we're not affiliated with or anything like that. But they're 12-step fellowships that have worked for years and years and years. It's basically the belief that one alcoholic or addict can help another alcoholic or addict better than anybody else. It's a level of understanding. It's a language that you can only speak or really know if you've been there. So one of the things that we think is important is to at least expose our patients to what the options are for them.
Yes.
Just as much as they may have had to hand select the drug that they use that worked the best for them, we kind of want to expose our patients to as much as we can on how to get well and how to heal, and they can pick what works the best for them. But they won't know what those things are unless we show them.
Exactly.
So, we do have a 12-step educator that runs a group every day. He kind of goes over just the basic principles of what the fellowship is, and there's thousands of meetings outside of in the communities that every patient will be returning to. So it's sort of something that they can try and they can do in our program, and if they are experiencing relief from it, then hopefully they continue it outside of the program.
Okay.
And then in addition to the 12-step, we also have a spiritual advisor. She does a spiritual service. It's non-religious. She works with a lot of patients. This is a disease that just affects not only the brain and the mind, but also the spirit.
That's
and so there's a big belief that that's a component that needs to be, and I feel strongly about that needs to be incorporated in some way.
Exactly.
A lot of our patients come in spiritually broken. They don't know their place in the world, or they feel like they never had one.
That's
and it's
right.
important for them to figure that out at some point in their journey. So that's hopefully the hope, is that, our spiritual advisor can help them kind of figure that out or get there. We have an art therapist that works with the patients. She runs groups all the time. She also does individual sessions with patients. We have a music therapist that works with the patients and does groups and individual sessions. We just try to expose people to as many different things as you can think of.
Exactly.
So that, they can grasp
some
onto something that
normalcy.
gives
Exactly.
them that feel-good feeling, or gives them that sense of purpose, that it's worth fighting for.
And once they get into the CSS, which is Clinical Stabilization Services, did I get that right?
It's easy to just say CSS,
Okay,
but yeah, you got it right.
So once they get into the CSS, how long do they usually stay in there for?
So we do base it on the individual, but the hope is that somebody stays with us for around 30 days. And the reason for that is, they're in the detox unit for maybe 5 to 7 days. That's when you're really kind of getting everything out of your system. Then you're coming up to CSS, and I kind of say you're detoxing from detox.
Exactly.
Because that's when there's really nothing being put into the system that's going to mask those things that might have been going on. And then we're kind of left with the person that has, you know, something within them that they're struggling with, a void, a mental illness, something that's been left, you know, unaddressed. And so that's when the work starts to happen in terms of working with their clinicians and their case managers and recovery counselors, recovery support specialists, nurses. I mean, they have conversations with our patients throughout every day of their stay.
Oh, wow.
And it could be the last conversation that you have on day 29 that changes a perspective of yours that may not have changed if you hadn't stayed that long.
Exactly.
And that's the reason that you do well outside of our walls. So, you know, a lot of times patients will say, well, what's one more day going to do? What's one more week going to do? And I don't know what the answer is, except that how will you know if you don't stay?
If you don't stay, yes.
It won't
exactly.
hurt.
Exactly.
So, you know, our patients are typically coming from dark places, and it's like, give us enough time to shed the light on what you need to do, because it is just a small drop in the bucket compared to, you know, the work that lies ahead of them.
Exactly.
But, you know, finishing something that they started, that's important. And I say that a lot to patients. It's like, you know, they usually come from a place where they had all good intentions. Like,
Yes.
I'm going to stop tomorrow. I'm not going
Exactly.
to drink anymore. I'm not
then
going to hurt my family, or whatever the case may be. And this
And
is
they
an
relapse.
opportunity for them to really finish something that they've started for the good reason. And it's that level of commitment that can really show somebody how far they can get in their recovery.
Perfect. And once they leave the center, do they continue to interact with their counselor, or?
So we actually have a lot of therapists that will say, you know, I got an email from, you know, Joe whatever.
Oh, wow.
Yeah, so a lot,
Okay.
even not only therapists, a lot of staff still stay connected with patients through their work email. Sometimes they'll call the unit desks and just say, you know, I'm still sober, I got 6
that's
months.
great.
That's like, you know, we have hard days. I won't lie, working in this field can be difficult. Some
Yeah.
days you walk away and you just, you know, you wonder, like, what am I doing this for?
Exactly.
But it's those phone calls. It's that person that
that
walks
make it
back
so
through
worth
the
it.
door
Yes.
6 months, 7 months later, a year, 2 years later. Now we're seeing patients that have 2 years. I mean, that's what, it fills your soul in a way that not many professions can. And that's what we always tell the staff that we work with is, like, we really do some amazing work with people that, you know, come into us so broken and leave us hopefully in a much better state than they walked in.
That is awesome work. And if you ask anyone who has spoken to me, I always say, if we lose one life, it's one life too many.
Absolutely.
So every little counts, and the work that you're doing is amazing. And I'm really, I've been talking about the statistics and how it is a big issue, and I'm really glad that today was focused into the hope part of it. All is not lost for these people. You just need to seek the help, and there's help out there.
Absolutely.
Just need to be able to get it. And I'm sure, and I'll turn to Janine here, some of these patients come with some comorbidities. So the nursing part of it, as the director of nursing, is really important, because we're talking about, yes, they have that addiction, which is a disease, but there might even be some other things that they're coming into the door with. So I'm sure you have a lot of nurses on the staff. So what is it that they do, or how do they help these patients get back to where we want them to be?
Right. So the nursing staff takes care of all aspects of the patient's needs. As you said, they come in with comorbidities. They may be a diabetic on insulin.
Exactly.
They may have hypertension prior to admission, and they're on medication for that. So the nurses on admission, they do a thorough assessment of the patient. They also identify any medications that the patient was taking prior. And we make sure if they don't bring them with them that we order them for them, and we continue that regime for them.
That's great.
And starting on detox, the nurses do frequent assessments of the patients for withdrawal symptoms so that they know how to medicate them and how to treat them to keep them comfortable. but they also monitor vital signs frequently.
Okay.
So a patient who perhaps has not previously been diagnosed with hypertension, but maybe that's because they haven't seen a doctor in many years.
That's so.
So the nurses may identify the blood pressure is elevated. It may or may not be due to detox, so they continue to monitor. And we have, the nurses are in close contact with our Chief Medical Officer, Dr. Ginter, who has been on your show previously, so they consult with her about the patient's needs and medications. We also have medical nurse practitioners in the facility 7 days a week.
Oh, that's
And
great.
we have a psychiatric nurse practitioner in the building 7 days a week, so we're trying to meet the patient's needs from every aspect. So same situation with any medical need. These patients, many of them have not seen a doctor.
For a long time.
So from the nurses to the nurse practitioners to the physicians, they may identify a new diagnosis,
Exactly.
a new chronic disease, and that might require medication or might require some monitoring. So they treat the whole patient, not just the patient going through the detox.
Detox, yes. And when that happens, if a new diagnosis comes across your desk, I suppose in collaboration with Dr. Ginter, you might start the patient on something, and there's going to be a follow-up after they leave with
Yes.
either primary care physician or...
Yes, that's where our case managers are instrumental with helping those patients. If they don't have a primary care physician, then they work with them to try and
Get them
become
on.
established with one in the location that they're going to be discharged to. Or if they're a diabetic and they want more than just a PCP, they want to see an endocrinologist, they will assist with getting a referral out there to that specialty upon discharge so that they can continue their care from a medical perspective when they leave. And or from a psychiatric perspective, if they're having a psychiatric issue, perhaps they've been diagnosed in the past, but again haven't been taking their medications.
Exactly.
Our providers can prescribe, our NPs, our physicians, but then we want that follow-up when they leave. We want to make sure that they have the correct follow-up care so that they're not going to stop taking their meds again or they're not going to get the treatment that they need.
Wow, that is really great. So just because I have diabetes, it doesn't mean I can't go to the detox center.
Correct.
It's because I will still get my insulin once I get there.
Absolutely.
Well, I can't thank you enough for this information. This is great news. For the people watching at home, you should all know there's hope out there. All is not lost. And please, if you know someone who is struggling with addiction, do not hesitate to seek help, because there's help out there. There's hope. They can be treated and they can get better and get back into the society.
Absolutely.
Well, thank you very much. Thank you, Kristen. Thank you.
Thank you for having us.
Thank you, and thank you, Janine.
Thank you.
And see you next time on Pharmacy Talks with D. Thank you very much.